Naloxone is an opioid receptor antagonist used to rapidly reverse an opioid overdose. Also included in some drug formulations as an abuse deterrent to prevent injection. In this video, let's find found. What is naloxone? What is naloxone used for? Contraindication. What are the side effects of taking naloxone? How does naloxone work? How to use naloxone? What is naloxone? Naloxone is a medication used to reverse or reduce the effects of opioids. It is used to counter decreased breathing in opioid overdose. Naloxone is a non-selective and competitive opioid receptor antagonist. It works by reversing the depression of the central nervous system and respiratory system caused by opioids. Naloxone was patented in 1961 and approved for opioid overdose in the United States in 1971. It is on the World Health Organization's list of essential medicines. Naloxone is available as a generic medication. Naloxone is an opioid receptor antagonist used to rapidly reverse an opioid overdose. Also included in some drug formulations as an abuse deterrent to prevent injection. In this video, let's find found. What is naloxone? What is naloxone used for? Contraindication. What are the side effects of taking naloxone? How does naloxone work? How to use naloxone? What is naloxone? Naloxone is a medication used to reverse or reduce the effects of opioids. It is used to counter decreased breathing in opioid overdose. Naloxone is a non-selective and competitive opioid receptor antagonist. It works by reversing the depression of the central nervous system and respiratory system caused by opioids. Naloxone was patented in 1961 and approved for opioid overdose in the United States in 1971. It is on the World Health Organization's list of essential medicines. Naloxone is available as a generic medication. Naloxone is an opioid receptor antagonist used to rapidly reverse an opioid overdose. Also included in some drug formulations as an abuse deterrent to prevent injection. In this video, let's find found. What is naloxone? What is naloxone used for? Contraindication. What are the side effects of taking naloxone? How does naloxone work? How to use naloxone? Pharmacodynamics. Naloxone is an opioid receptor antagonist indicated in the reversal of opioid overdoses. Naloxone has a shorter duration of action than opioids and multiple doses may be required. The therapeutic window of naloxone is wide, as it has no effect if a patient has not taken opioids. Patients treated with naloxone may experience opioid withdrawal, and a person administering naloxone should be aware that reversal of opioid overdoses may not resolve all the symptoms a patient is experiencing if other drugs are involved. Mechanism of action. Naloxone is a competitive inhibitor of the opioid receptor. Naloxone antagonizes the action of opioids, reversing their effects. If a patient has not taken opioids, naloxone does not have a significant effect on patients. Half-life. The mean half-life of naloxone hydrochloride is 1.8 to 2.7 hours intranasally, 1.4 hours intramuscularly, and 1.2 hours intravenously. Dose. Opioid overdose. Indicated for the complete or partial reversal of opioid depression, including respiratory depression, induced by natural and synthetic opioids. 0.4 to 2 mg 4/IM/SC, repeat Q2-3 minute PRN, to exceed 10 mg, 0.01 mg per kilogram. Consider other causes of respiratory depression if desired response not achieved after administering 10 mg cumulative total. Endotracheal. This is the least desirable route of administration and supported only by anecdotal evidence, 2.5 times, 0.8 to 5 mg, initial 4 dose. For chronic opioid abuse, use smallest doses, 0.1 to 0.2 mg, to avoid acute withdrawal, titrate to reversal of respiratory depression. Following reversal, additional doses may need to be administered at later interval, i.e., 20 to 60 minutes, depending on type and duration of opioid. Reversal of respiratory depression with therapeutic opioid doses. 0.04 to 0.4 mg 4/IM/SC initially, may repeat until desired response achieved. If desired response not observed after 0.8 mg total, consider other causes of respiratory depression. Postoperative opioid depression. 0.1 to 0.2 mg 4 Q2-3 minute to desired degree of reversal, e.g., adequate ventilation and alertness without significant pain. May repeat within 1 to 2 hour intervals depending on amount, type, e.g., short or long acting, and timing of last dose administered. Supplemental IM doses have produced longer lasting effects. Safety advice. U.S. FDA Pregnancy Category C. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. That's all the information about naloxone we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.